All right, sounds good.
All right, good afternoon. It's 4 o'clock by my watch. Obviously, there's something wrong with the town's clock. The October 19th, 2017 meeting of the Board of Health is now open. Just to remind you all that this meeting is being audio and visually recorded. Are there any comments from the public on any item that is not on the agenda? Hearing none, we'll move on to the review of the minutes of September 21st. I understand there's been a suggested correction.
Yes.
Yes. So the police chief brought up to my attention that there was a slight misquoting under the director's report for the marijuana, where Mr. Cooper had said that the police department do not have anything to enforce, where what was actually said was that there is nothing on record at that point, because the police do need to enforce
Yes.
all the federal mandates and the state laws. So they do have that to enforce. So there is a correction that did need to be done there just to correct the wording.
And how would you word that correction, and we'll vote on that correction?
The correction was that when Mr. Cooper spoke with the police department, that he was told that there was nothing on record. That was the specific wording, on record,
Right.
rather than nothing to enforce. So
It should be on record.
It should be on record.
Okay. I have a motion to amend the minutes as stated.
So,
Second.
Any further discussion? All in favor of that amendment?
Aye.
Say aye. It's unanimous. Are those present? Are there any additions or other suggestions from the minutes? And may I have a motion to approve the minutes as amended?
Second.
Any further discussion? All in favor say aye.
Aye.
The minutes of September 21st are approved as we agreed to amend them. We have 3 loan requests.
All 3 are your standard loan requests. They're looking to, there is a septic upgrade for Pulpus Road, and then the other 2 are to connect to the sewer on Dukes Road. We recommend all 3.
Okay, so the first one is for
16 Dukes.
sewer connection, 16 Dukes Road. Do I have a motion to approve?
To move. Second. Second.
Any further discussion? All in favor of a loan for a septic connection on 16 Dukes Road, say aye.
Aye.
Chairman says aye. The next loan request is for 14 Dukes Road for the same reason, to connect to sewer. Do I hear a motion?
so moved.
Second.
Any further discussion? All in favor of approving the loan for 14 Dukes Road for a sewer connection, say aye.
Aye.
Chairman says aye. That is approved. The next for 284 Pulpus Road is for a sewer upgrade.
A septic upgrade to an IA.
I'm sorry, septic upgrade. Do I hear a motion for that loan approval?
I just have one question.
Yeah.
Is that road doing an IA system?
Yes.
Okay.
Yes. IA.
Okay.
So moved.
Second.
Any further discussion? All in favor of a loan for septic upgrade at 284 Pulpus Road, say aye.
Aye.
Chairman says aye. That loan is also approved. We also have an ACO request for 7 Washington Avenue.
The ACO request for Washington Avenue is same thing. Where it's in preparation of the possibility of sewer.
Right.
So they would like to enter the ACO for the transfer of the property. No objections on our part.
I see no objections. Do I have a motion to approve the ACO request for 7 Washington Avenue?
So moved. Second.
Any further discussion? All in favor of an ACO request for 7 Washington Avenue, say aye.
Aye.
Chairman says aye. That ACO request is approved. Next, we go to variance for 8 Bessett Road.
So I'll let Dan actually.
Yeah, go ahead.
Good afternoon, Dan Malloy, Site Design Engineering for the owners. We have a slightly odd, I guess, situation on this one.
I call it interesting.
Interesting, that's a better way to put it. So we have a case where back in 2009, a septic system was approved was approved by staff in the office. It never came before the board. That's a separate issue whether or not that should have occurred, but it's passed at this point. So in 2009, a system was approved for 4 bedrooms to on the property. For some reason, unbeknownst to me and most people, the system has yet to be constructed. Now it's 2017, that permit has expired. And on top of it expiring is the Harbor District, which now requires an IEA system anyways.
Right.
So we're back before you looking for approval, reapproval essentially of a 4-bedroom system for the property with, in this case, 2 different IEA components and a variance request to bring it up to what would have been proper code when it was originally approved. And the variance request in this case is definitely an interesting, to use your terms, interesting need. So you have the 100-foot setback from a wetland for any leaching areas. The proposed system, as it's designed, does not require a waiver. What requires a waiver, the IEA systems we're using, so we have a Septitech treatment unit, and we're using a drip irrigation drip system
Right.
for the leaching area instead of a conventional leaching field. So the use of all of those components and the area reduction to make everything fit, what DEP says in their approvals is prior to you getting approval to put this in the ground, you have to show that a regular conventional system could fit on the property. And that is the issue. So, and by conventional, it's just a regular straight system, no waivers or anything else. So by state code, there's no waivers required, everything
Right.
is fine.
What you need by our codes.
So by local code, essentially what we have to do is show you a proof plan that says this is what a conventional system would look like, and this is where it would go. Now, it's physically impossible to build a conventional primary leaching area and a reserve area on the property without a 100-foot waiver. The plan that was approved previously had the proposed leaching area outside the 100-foot, so that portion was compliant. But it had the reserve area inside the 100. Essentially, there isn't enough room outside the 100-foot buffer zone in any situation for the primary and the reserve to fit, with the exception of the design that's before you. So,
And the reason for the reserve, educate me again.
so under this Title V, the septic code, you have to have the primary leaching area and the reserve are a backup.
Right.
So if the primary should fail, you have a place to build a new one. In reality, the new one, 99% of the time, goes back in the same location rather than in their backup area because nobody wants to destroy whatever's there. They just dig up the same one and replace it.
Right.
If you have 100% of the primary, what is the percentage you would have left for the reserve?
Depends on the scenario. So in the design that's before you for the application requesting the waiver, we have 100% of everything outside the buffer.
Okay.
The primary and the reserve. Everything's outside. But in order for you to approve that, we need you as a board to be okay with us showing a proof plan with part of the reserve, well, the whole reserve area inside the buffer zone. I can't see a scenario where it would ever actually be built. So it's a confusing scenario. So we can prove everything works. We have a design with everything outside the 100-foot buffer. No problems, no
Right.
waivers associated with that. But to show that the backup areas are all there, we need the 100-foot waiver. If that's, I'm not sure of a clearer way to put this. It's not exactly straightforward.
Do you want to educate us a little more? Because I think I get it.
There's not much more I can
Yeah.
say that Dan didn't already say. If we do strict adherence to our local code, it's a no-go, even though that area will never be used.
Right.
If we use just adherence to Title V, which is basically what we're asking, the whole system would fit. So it's a very just interesting
Right, but
situation.
they're still putting in an IA system, and
It's- Two
IA systems.
Two IA
So
components.
the total nitrogen load should be significantly reduced.
Significantly.
And that's what we're,
Doubly, actually. The drip dispersal system is
Yeah.
within the what's called the A layer of the soil. So actually a lot of what gets dropped out of a drip dispersal evaporates. Never even makes it to the groundwater.
so the system is a double system, essentially, of an IA system, so there'll be significant nitrogen reducing. So we're dealing with a wording,
It's a technical.
technical wording, not so much as, I don't
Functional.
see a major environmental problem there.
Yeah.
Maybe I'm confused. In a regular Title V system, you have 100% that you're going to use and 100% that you need
Hmm.
afterwards. And my
Yes.
question was, if they want, the way we want it, if we let them have it, they will have the 100-foot that they need to run the system, but how much of the 100% will they have without getting what they need from us?
As far as the drip dispersal goes, you can move the lines to fit any contour you want.
Okay.
So the IA situation will always be in compliance.
Yes.
The technical part here is that they also need to show a reserve area for a traditional system,
Right.
which is strict rectangular area. And when you set it up like that, there's no room
But the probability of that ever
of ever using.
using is remote.
It's remote. This system, when installed, even if it's abused, should last close to at least 10 years. It can last 20 or more. Between now and then, there is technologies that are always being created.
Changed and upgraded.
Rules are always changed and upgraded.
Right.
And for all we know, sewer might be coming out there in that time frame too.
That would be nice.
The thing is, let me ask you one, is there anything that we need to protect ourselves when we give him this variance, if something unexpected does happen?
You mean stipulation?
Yes, I mean, so that, if it does, turns out that it ends up not working, there's not enough reserve space, and we give them the permit to completely go ahead with this thing, I just don't want it coming back and hitting us.
I can probably
Yeah, that's
Can't help on
very
that one.
And then I know
So-
Jim has a question, so why don't you
Yeah.
answer?
So I can cover that
very
in
difficult.
a couple of ways. So if the system fails, there is a reserve area, so there is a second place to put it. But to back it up even further, if you opted not to grant the variance for this particular design, we would be forced to come back to you for the next meeting for the same variance. As by code, they're allowed 3 bedrooms, by your local code, and even to comply with that, we would still need the variance.
Right.
So even to fall back, no matter, there's not a precedent necessarily for you in this case where any fallback still requires a variance. Anything different still requires a variance to make it fit. And like I said, there is a primary and reserve space. There's certainly adequate space available for this technology to work. But regardless of how we do it, we will be standing here in front of you asking for a variance.
Right. I know, Jim, you had a question?
So, what I thought I heard you say is for the traditional field, your system, you have enough, primary and reserve?
For a traditional system, we only have room for the primary.
Oh, okay, so that's where I misunderstood. Okay, so you're talking
Without the
about
waiver.
primary and reserve for IA? That you,
In the IA's proposed system that's in front of you, we
Right.
have enough room for both.
okay.
The fallback would be the system that was approved prior to this years ago. We could fit the primary, but not the reserve.
Okay. And I think your question was how much reserve is there left?
That was my question.
Right. So in the design we have now was 100% outside the 100-foot buffer, 100% of everything, primary and reserve.
So then, what is the variance that you're asking state?
The variance, that's an interesting wording. I'm not quite sure how that gets worded, but
That's why I used the word.
Yeah.
the variance is a request to prove that we could do something the conventional way. that we have no intention of doing.
Which we don't want you to do anyway.
Which nobody wants
So
to do.
you're
We don't
asking us
want-
to
but
give you a variance
order
to
to
prove
use-
something we don't want you to do.
In order to use the technology, the regulations require proof that conventional would work.
It,
And
it's,
it only works with your variance.
And so we're basically telling you that you don't have to show us the proof that it would work if it's Title V.
I still have to show you the proof that it would, by Title V it works. I have to show you the proof
Right,
how it works, where it sits,
right.
Right.
and that's your proof that a variance is required, and that area has to be allowed to exist if it's ever needed.
And we
It's-
can't stipulate, as you mentioned, a variance that would require that not to be built?
You,
there's
you can. It's required by code that it has to be
yeah
available.
what's really odd is what makes it such an odd variance is it's more of a proof of concept variance. There's the basic layer of Title V, and then there's the added layer of the IA component. The basic layer of Title V requires that they show the reserve area, which of a traditional system, a non-nitrogen reducing system, which is what you can't show here in this situation. They can't show 100% of the reserve area for a non-traditional system, which we wouldn't allow anyway.
We wouldn't allow it anyway, so I
But-
don't know why we're here, so when I think about it.
It's just because it's a technical variance that is required from the state code in order for them to move forward with a fully functional IA area with a fully functional reserve area for the IA system.
And we
So-
have the authority to do that.
Yes.
Yeah.
Okay.
So this reminds me of the whole thing with the restaurants and the bathrooms, okay?
Yeah, right.
So,
It's the same
I just
thing.
don't want anything coming.
yeah,
from-
so
Yeah.
so is that a thing legal counsel should review to, or is that?
No, not necessarily. You have the full authority to vary Title V, and in this, even to vary the local regulations. There's actually a local regulation that's requiring this. Title V only requires a 50-foot buffer. So it's odd.
If it
It-
helps you, in the last 20 years, this is the first time.
This is the very first time I've ever seen
we've had
something
to-
like this.
Approach something like this.
Doesn't that really even make it more necessary for us to include something
Yeah.
so that it's not perceived as
Right.
precedence set?
I don't know how you would include anything.
As far as precedent goes, I don't know if there's ever any precedent that will be set with something like this, because this is a sliver lot, so it's very long and
Yeah.
narrow, but it still meets all 40,000 square feet. And what cuts the lot more than in half is this wetland buffer, not the wetland itself,
But
but
the
just the buffer. So that's what makes things really difficult.
The only thing I want to say, and then I'm done, is I don't want anyone coming back saying that they designed it, said it would work. We gave them variance. Everybody said it would work. And for some strange reason down the road, it doesn't work. Why did you give these guys a variance? And if everybody's all right with it,
Well,
I just don't want,
if it doesn't work, they have to fix it.
If it doesn't work, they have to fix
Whatever,
it. and
whatever we do. Yeah.
Ultimately, if it doesn't work, they have to fix it. And two, if it doesn't work, we're not the ones who installed it. So actually, it ends up on Dan's
I'll
liability.
get in that phone call.
Yeah.
So what happens, it's no different than any other technology component, whether it's all the septic techs or fast systems, anything else. If for some reason those aren't functioning, whatever you approved as a board is you're not responsible for its construction or function. It's like any other system. If it ever fails or has a problem, it has to be redesigned or fixed.
Yeah.
So it's not your liability in that
Right.
case. For how
I
that
don't see a
functions.
liability. I don't see could be an issue that we can't even think about, but the point is, it's almost a double system. They're reducing the nitrogen load, and we're in kind of a problem of wording.
Yes.
And to me, the function is to reduce the nitrogen load on this island. And if something goes wrong, they'll fix it.
okay.
It's not our problem. That's my view. I don't know what the rest of the board
And
thinks.
if I can add to that, we're not looking for any groundwater waivers.
No.
We're not looking for any bedroom increases or anything else. It's strictly a dimensional strictly dimensional things that we're talking about, so no flow changes whatsoever for this.
But is there a scenario that if we grant this waiver, let's say they sold the lot, someone could come in and build the traditional system?
No,
No.
it's in the watershed. We won't allow it.
Okay.
There's no way they can do that
No.
because it's in the watershed area. It has to be IA system.
Right.
Yes.
This septic system controls the property. Everything functions and revolves around
Yeah.
this.
Oh, okay.
Yeah.
All right.
All right. Any other discussion? Can I hear a motion one way?
All right. I make a motion to approve the variance.
All right, I'll second.
Any further discussion? All in favor of approving the variance, say aye.
Aye.
Chairman says aye. Variance is approved.
Thank you.
Okay.
22 Hawthorne Lane.
Yes. So this is just more of an update. We had a hearing with Barnstable County last week. There was effectively a settlement that was agreed with our town council and the owners' council, where the permit was to be pulled on Friday and then the work were to be done immediately. The permit was pulled and issued on Friday. And then I have been updated by the client's engineer saying that Mr. Perry is working on getting all the components in the ground within the time frame set. So we are happy to say that there is significant progress being done on this property.
And the estimated time of completion?
We have to give an update to the court on the 23rd, and then from there, we'll get another time up to completion. So on Tuesday, I have to give an update. Thursday, sorry,
Right.
I have to give an update to our town council, and then they'll give them the extra 14 days that are needed from there. So as needed, as long as there's progress being done, which we believe there is progress.
Any comments, questions from the board?
I mean, do you have any kind of timeline? Would you think this project could be completed?
I believe the clients are here, so if they have a timeline, do you know when the project might be completed? Okay.
Thanks. For the record, Paul Santos with Nantucket Surveyors. So there is an IA component now within this system because it's in the Hummock Pond watershed.
Yes.
So that component has to be manufactured and ordered off island. It's a microfast system which is produced by JR Precast, I believe it is. So that's been ordered. So that's the one component. The trench component, which is taking out the trenches and replacing, we staked out the system this afternoon, and we expect that Rich Perry will be in there shortly to at least fix the trench component, and then the IA component, which is a new tank. We're dependent upon when that unit is manufactured and then shipped over to the island. It's probably a 2 to 3 week process on that component. But the trench component would actually be done before then, because that work can be done right away. And I expect that they're in there. I think they're supposed to be in there within the next, probably beginning of next week to start that work. So, which if you didn't, if this was not in the Hummock Pond watershed, that tank could stay in the place, and the trench would be repaired. Now that it's in the Hummock Pond watershed, the IA component is what will take a little bit longer to put in. But the tank that's there can still be used, and the hydraulic failure can be repaired. That'll be done, I would say, within the week.
So I still ask the same question. In your estimation, what do you think of?
I'd probably say, I think it's going to take probably a week and a half to manufacture that thing, get it over here. So I'd probably say 3 weeks. 3 weeks or so, I would say. So, but the hydraulic failure component will be repaired in less time than that.
Yeah.
Yeah. The system will be functional.
Yeah, the system will be functional under your regs, with the exception of the IA component not being in place.
Okay, good.
So,
Thank you.
Thank you.
Thank you for your help on this. All right, so that's progress. Strategic plan.
Yes. So I'm just looking for comments, suggestions on the strategic plan. I know there was a suggestion for the community health assessment that was also sent out to add cardiovascular risk to one of our priorities. So I will be working on that. It will be our 6th priority. And then there were a few wording suggestions from Mr. Kelly. But if you need any more, if you have any suggestions, any comments on the strategic plan, I'd be happy to.
I don't know if this comes under the thing my question is, when does the contract end for the landfill?
2025.
25, so that's a long.
Yeah, that's still outside of our 5-year plan.
I'd talked to some of these issues with Roberta before about the health assessment. Yeah, one, there's a big graph that shows cardiovascular death is what kills us all.
But there's no...
And to me, that's an easy, well, not easy, it's, there's a lot of public health issues that can be done.
Yes.
Lose weight, exercise, eat a diet, et cetera.
Yes.
And that brings me to the other thing. One of the biggest public health problems in the country today is the rising amount of obesity. And
Yes.
you never teased any of that out of this? Is that an issue on this island?
The rate of obesity that we've been seeing on this island is actually lower than the national average.
That's good.
We don't have access to fast food. We don't have access to those sorts of things. So we are actually kind of in a way, a closed cohort.
Right, but do we track that somewhere? I mean, the schools, they have...
The schools do track that data, and I could tease out some of that
I would
data.
love to know about that.
Okay.
I would like to actually see some numbers instead of just, we're lower.
Okay.
Because, I mean, that would be, in a way, almost terrific news, and it's something we can talk about our healthy island. Come here and you don't have to eat cat food. Or is it because the food's so expensive here, no one
can afford to eat.
can afford to eat?
No one eats it.
That is also possible. As far as the scientific basis of it, I don't know if it's.
I don't know.
Like you and I have discussed, I don't know if it's a significantly different
I don't know.
number.
I'm just curious. And the other thing I'd suggested to Roberto was maybe to tone the introduction a little bit, because
Yes.
this is like the survey has a small number of people, what's probably not all that valid. And there's a thing called 95% confidence intervals that should go around these statistics, which are available.
Yes.
But I'm not sure the average person will understand it. But sometimes some of these things where there appears to be differences, I'm not sure there really is, because the intervals will overlap. Or in some cases, for example, in the 95% confidence interval over female breast cancer, it really says it's above the Massachusetts average from 3% to 40%. So 3%.
Yeah, it's not statistically
mushy.
significant. Yes.
So I think the introduction should sort of state that this is a guideline,
Yes.
and that we probably can't do any better statistically, because the other problems, we have such small sample sizes on this island.
Yes. Yeah.
And I just like it toned a little bit.
Yes, that is a very good point that Dr. McNabb and I have discussed, that this is not a fully peer-reviewed scientific document. It is a guidance document just for our office, for our board, and also to pursue the purposes of accreditation.
Yeah.
So it's not a full peer-reviewed journal study.
When do you anticipate it being ready for distribution?
As soon as we approve it here, because the community health assessment is a purely internal departmental document. So as soon as you're okay with signing off on it, we will be okay to distribate it.
Just play with those changes. And then
I'll
look at
I'll
it.
definitely add it to the next
Yeah.
Board of Health meeting.
So in that, when you were just talking about it, so you're saying that statistically, I'm not sure what the words I'm trying to use are. It's interesting information, but it's not actionable.
No, I think it's actionable.
Oh, okay.
It's just, I think the wording has to be that this is very suggestive that these are the problems.
Okay.
I wouldn't,
Okay.
it would never get published in a peer-reviewed
Yes,
journal.
without any of that. So in the biostatistics world, there's kind of a variance when you give a number. Let's say the number is 10. It's 10 times worse than whatever. You have 10 times the odds. Depending on your sample size and the power of the statistics that you're running, there's a area of uncertainty around that number. What is happening here with for example, the breast cancer one, that number, let's say if 0 is the null, 0 saying that there is no difference from the state, it's going down to really close to 0 and also up to a number that can be even more extreme.
Right. So
that was the 3 to 40.
Yes.
it could be well, breast cancer is a problem anyways. The
Yes.
point is it's a problem. How much of a problem is on the island
Yeah.
compared to the rest of the state is
Yeah.
not certain.
So what we're calling it is more, I think a term that might be easier to understand is that it is statistically significant, but not necessarily clinically significant.
Yeah, but if you look at the death rate of cardiovascular disease, I mean, you don't need statistics on that.
Yeah.
Because it's way above.
It's way above.
It's way above the.
And there's a lot of confounders with things like that, which we didn't analyze in the community health assessment. That could be a paper in its own. We do have an older population over the summer.
Yeah.
It is expensive to live on Nantucket, so to own property on Nantucket. So we do skew a little bit to the older population, and then when they come here to the summer, we have we have a census data of 11,000 people on Nantucket. We have closer to 70,000 people on Nantucket, so the incidence rate of cardiovascular events over these 4 months are that of a city of 70,000
Yeah.
in that 4-month period. So we can do a full logistical regression and multivariate analysis
you're
on
not going
this,
to be able. You don't have the powers to do
but
that.
we don't have the strength to do that right now.
I think the document is great in the sense that it prioritizes
Exactly.
and the things you'd pick out if you knew Nantucket, and this gives it a little more meat than just someone's opinion
Exactly.
that this is a problem.
So I think it's just as a layperson, but I think it's fascinating to link that, the 4-month population with cardiovascular events, because that may be more something you'd want to think about rather than the incidence of primary, cancers within that group of people for 4 months or metastasis or something. So
It's not an easy task.
Yeah.
And I just have I won't be long on the plan. I think this on the weakness community health division.
Yes, sir.
What does that mean?
So when we did our SWOT analysis, one of the weaknesses that we found with our stakeholders was that we don't do any of our community health work. So modern public health has been split into the two different disciplines of environmental health and community health.
Right.
Environmental health is basically all we do. It's food inspections, housing inspections, septic systems, things like that. Community health is work like suicide prevention, proper hand washing techniques for trainings, proper hand washing trainings, outbreak prevention, things like that. We don't have any capacity for that other than myself, and I can't be out there doing all these trainings. So one of the requests that we have, you'll see it in one
I
of the
saw that,
priorities, is to get a community health officer and a community health education specialist.
Yeah.
One of these people, what these positions would do is hopefully we can get a multilingual person, at least bilingual, to be able to reach out to the other populations that we have actually been neglecting on this island for many years. So part of what that is to reduce that gap in racial health disparities. And that would fall solely on the shoulders of the community health officer.
Yeah, community health office, community health educator. Most health departments have such a person.
A lot of health departments in the state of Massachusetts have moved to an ISD model where an inspectional services department handles every inspection, building, plumbing, fire, health, everything. And the health department is a purely community health office with a public health nurse and community health work. We are one of the few all-encompassing health departments in the state of Massachusetts. And we have one of the lowest amounts of FTEs in comparison to the amount of work that is being done.
I agree with you.
Our most recent report in my budget that I submitted, it came out. I did some analysis on our data, and we had a little bit over 758 inspections per person, per FTE, just the inspections. That's not counting paperwork, phone calls, things like that.
That's a lot.
Yes.
So maybe the Board of Selectmen will be sympathetic to your...
Our plight.
So did you put FTE request in your budget request?
Yes, sir. I
And
put in
what
I
did
put
you
in
put in?
2 extra FTE. This one for another inspector to reduce the burden of inspections, and for a community health officer.
I'd really support a community health officer because we really don't do anything.
Yes.
Talk a lot about it. The other thing here in behavioral health you called telepsychiatry.
Yes.
Can we get our own psychiatrist? Probably not, yeah?
If we're willing to, it's a funding issue if
Yeah,
we
of
were to
course
be
it
able to
is.
do that. However, it is possible. There are multiple health departments across the country, not in Massachusetts that I know of, but there are the New York Department of Health and Hygiene and Mental Health Hygiene. They have psychiatrists on staff that do telepsychiatry as well for the more rural areas of the state of New York.
Yeah. No.
So I don't know if this is possible, but whether it's mental health or community health or environmental, I guess maybe it's so there's a system of that's part of an entire system of let's say community or mental health. So and if you like. I'm sure, and I don't know if their mental health task force is doing this kind of stuff, but mapping out kind of what the ideal system might be, and then identifying what do we have now and what are the blank spaces and how best to fit them in, and if that's true, how did your thinking kind of integrate with that conversation?
Actually, one of the people who did the SWOT analysis with us and who was considered one of the stakeholders was Tess D'Alberti, the executive director at Fairwinds. And we work closely together, Tess and I, to identify these sorts of gaps. And the Behavioral Health Task Force has been working to look at these tasks and identify where we can plug the holes right now on the sinking ship, so that we can make sure we're moving forward without spiraling into a deeper situation.
And the other comment you have, Eat Smart Restaurant Week. Could we have an Eat Smart year-round?
Definitely. Absolutely. And that's all something that a community health officer is charged with doing. We have our restaurant weeks already. It would be something that we can definitely look into of Eat Smart items on menus. I did this in Everett, actually, the Healthy Choice menus in the city of Everett. We were able to partner with specific restaurants, and they submit a recipe to a nutritionist that the state of Massachusetts offers already. They already offer it, and they do the full analysis and identify which ones are the Healthy Choice options.
Any other comments on either document from anyone?
That's good.
Okay.
So you want us, you've got our comments, we'll formally approve them next time?
Yep, I'll go ahead
Is that within your time frame?
Yes, absolutely. I will go ahead and start looking into the cardiovascular disease
Well, yeah,
one
I
and
mean,
the obesity data.
I call it a suggestion. This is your document.
I think it's actually it's a very great point, and it's an oversight on our part. So I will definitely add that. I'll look into the obesity data. I don't know if we'll be able to really tease that into the
Probably
CHA,
not,
but definitely
just
put some
from my
information
personal
out.
knowledge,
Yeah.
it's interesting what you say, and
Yes.
the fact that we don't have fast food on this island. That is absolutely fascinating to me.
It's a big one. It's a big one. I'll get you the information where I read that. It was actually the Robert Wood Johnson Foundation, the county health.
It will
rankings.
help if anyone wants to have fast food on this island.
We can argue.
We can have a great argument.
Yes, sir.
Okay, thank you. Director's report?
We covered actually almost everything I was going to say because I was going to really push into the budget request for a community health officer.
Yeah.
The one last one is Hank's been working really hard on speaking with Mr. Wallace and Mr. O'Banion to get our venison donation program up and running.
Good.
We should expect, once we get the confirmation, I will put a advertisement out in the newspaper to get that out there. And then,
Do social media as well?
Yes.
Getting
Yes, we
it
do.
out? 'Cause yeah.
Yep. And there were a few suggestions about getting it to the Nantucket Hunters Group, apparently. I didn't know there was a Hunters Group on
Hunters
Facebook.
Association.
Well, we knew of the Hunters Association. We've always worked with them, but there's apparently on social media
Oh,
a Hunters Group where they plan things, and I had no idea about that, so that's going to be added. And then we'll be getting the advertisement out into the Inky as soon as we can, as soon as we get it confirmed.
And bow and arrow season is in effect right now, right?
Yes.
You opened on Monday.
So-
Yeah.
The deer thing, when does that start?
ASAP, as soon as we get the confirmation from Dylan. Unfortunately, Dylan had a health issue that forced us to slow down the process.
Okay.
Mhm.
Any other issues, items, questions? And if I hear no objections, we'll adjourn the meeting until next month.